My name is Adani Sanchez. I'm the Client Services Coordinator at Champaign County Healthcare Consumers. And I just wanted to welcome you all to our Medicare Q&A session. You're going to be hearing from our Medicare specialist, Nicole Mitchell, soon enough, but I just wanted to welcome you all to this meeting, talk a little bit about healthcare consumers, and then just do some housekeeping. We are going to be talking about a lot of information. So again, this is not meant to be a presentation for your specific situation. So again, this is going to be an overview so that if you have specific questions about your situation, take some notes and then make sure to set up an appointment with one of our shift counselors. We're going to have several people available for appointments. So just, keep that in mind, take notes about what your situations are, what your questions are. You can always email folks. So we are going to have questions at the end. But again, remember, this is just to kind of share some information. And then once you're ready to set up an appointment, you can set up an appointment and do a deep dive about the specific questions that you have. We've got snacks and coffee in the back. We have bathrooms outside to your right. And then I guess I'll just get started a little bit about healthcare consumers. Champaign County Healthcare Consumers was founded in 1977. This organization does both direct service work and community organizing and advocacy. This has been a really important balance for us because it means that working directly with people, we can see the problems that they are engaging with, the issues that they're having, and then that can help us actually bring that up to other people who make policy and advocate for policy changes depending on the issues that we see. So thank you so much for being a part of that and supporting our work and being here today. So I will send it off to Nicole Mitchell. Thank you.
Good morning. How's everybody doing? Woo! Yay, Medicare! Okay. All right, just a little basic start just to sit and consider, what type of coverage you do have while you're sitting here. We're going to start with Medicare basics. I know most of you sitting in this room right now already have Medicare, but just in case, we're just going to go over the little bitty basics here. So of course everybody starts off on traditional Medicare, which is Part A hospital insurance. I like to call it inpatient because it's anything that has to be inpatient. Your medical insurance, and then a Part B prescription drug plan, which just covers your medications. So Part A hospital insurance, that's free, no premium for most people. The ones who end up with a premium tend to have worked, made too much money in their lives, so most people get that for free. But you must have paid into Medicare for at least 40 quarters or were married to someone who qualifies. You don't just get it because you're 65. You have to have put in the credits. And if you do not qualify for free Medicare Part A, there's always a pay-in as well. So original Medicare Part A has a deductible of, now this is $1,684 in 2025. We do not have a prediction for 2026 yet. That's, again, inpatient. So you have the inpatient hospital stay, skilled nursing care, hospice care, and some home health care. Anything considered inpatient. Now Part B, the monthly premium is predicted to be $206.50. Right now it's $185. They do not come out with that number officially till like mid-November because, let's just make it more complicated. That's fine. Now the Part B also has a projected annual deductible of $288. Right now that is $257. There is a penalty if you do not sign up for Part B when you first become eligible, and if you do not have any other creditable coverage. If you are currently working and you have employer insurance, you do not have to pick up Medicare as long as the insurance is as good or better than Medicare. So Part B covers, this is the bulk of your insurance. It covers your doctor's services, outpatient hospital care, emergency room visits, durable medical equipment. Really the bulk of your medical. But what it does not cover is vision. You get a little bit of coverage for cataract if it's considered medical to cover it. You do not get vision, dental, hearing, or long-term care, which is called home health. Now, enrolling in Medicare Part A and B is through the Social Security Administration. The easiest route is to go on socialsecurity.gov. CCHCC can actually help you make an account if you need it, because it can be complicated. You will be automatically enrolled into Medicare if you are already pulling Social Security retirement benefits, or if you have had disability for 24 months, they will just automatically enroll you. And you'll get your Medicare card in the mail. Let's see, if you are not taking your Social Security benefits, you do need to actively sign up for Medicare through Social Security. If you do not, in that time frame when you were first eligible and you do not have that credible coverage, you are at risk of a penalty. Your initial enrollment period is 3 months before you turn 65, the month of your 61st birthday, 65th, excuse me, and 3 months after you turn 65. So if you miss your initial enrollment period, and you do not have a special enrollment period, there are lots of different reasons you can get that. You will be able to enroll during what's called the general enrollment period. There's a lot of enrollment periods, I'm sorry for that. This is January 1st through March 31st of each year. Most people don't end up there, but it's available if you need it. All right, prescription drug coverage. So this is Medicare-approved private insurance companies that offer plans with varying premiums, and it's just prescription drug coverage. While they are provided through insurance companies, all they cover are your meds. Each plan does have different formularies. Each plan covers different medications, and they cover them at different price with different pharmacies and network. There is a penalty if you do not sign up for Part D when you become eligible, and in my opinion, it's worse than the Part B penalty. Enrollment is through Medicare during your initial enrollment period, when you lose credible coverage, as well as the annual open enrollment period. Lots of enrollment periods as we went over. All right, so in 2026 Part D plans, there are 12 different plans offered from 6 different companies, and premiums range from $0 to $119.70 per month. There are lots of plans with a $0 premium. There are, I think, 2 or 3. And deductibles range anywhere from $0 to $615. Only one plan has that $0 deductible. Most plans around here have something. When you are looking at Part D plans, you want to consider, obviously, does it cover all of your medications? Does it cover your pharmacy? And can you afford the deductible? So now we're going to get into Advantage plans a little bit here. So when you first get Medicare, everybody gets on that traditional, and then you have the option to either pick up a Part D plan and possibly a supplement, or pick up an Advantage plan, which covers your Part A, Part B, and your Part D all into one. Most people here are probably an Advantage plan. How many of you are in Health Alliance? Yeah, look at all the hands. All right. So when you enroll in an Advantage plan, the insurer takes care of your Part A and Part B benefits, and typically Part D as well. There are some plans available without Part D coverage. Those are mostly for veterans. Most of you guys in here won't touch those. Advantage plans may offer additional benefits not covered by original Medicare, including some hearing, vision, and or dental benefits or fitness benefits. They can come with little bells and whistles. Now you do actually get a trial period. Not a lot of people know this. You get a trial period for your Advantage plan. So those of you going from Health Alliance to somewhere else are going to love hearing this. In the first few months of the year, January 1st through March 31st, you have the ability to change your Advantage plan if it does not work for you. So if we get you into a new Advantage plan for the year and it ends up not working or you don't like it, we can change it before March 31st. Now there are supplemental plans, so these work with traditional Medicare. And those cover the parts of Medicare that you are normally responsible for. So they would cover the 20% coinsurance and deductibles, the Part A deductible specifically. The plans do not cover the Part B deductible. They do cost an extra premium per month. Now those of you, I don't know if I put, yes, those of you with Health Alliance, hello. You get a special enrollment period this year to actually pick up a supplemental plan without medical underwriting. So when you first get Medicare, that's normally your time to pick up a supplemental without medical underwriting. Then after that 7-month period, anytime you pick up a supplemental, they could charge you more for your health or your age or just about anything. Since you are losing your plan and it is going away, you will now have the availability to go back to traditional Medicare and pick up a supplemental without that medical underwriting if you so choose. And you do need to pick a Part D plan in order to get into that particular scenario. So a little bit of the differences, supplements, as the word is there, it supplements original Medicare. It will pay the parts of Medicare that you are normally responsible for, except the Part B premium and the Part B deductible. That's if you pick up a Part G plan. There's a lot to that. I won't get into it. I'll be simple. It's got the same benefits. You do not get any extra benefits by picking up a supplemental. Some might have discounts for vision, hearing, or dental, but they do not have actual benefits for those things. They do not provide any coverage outside of the United States. You still have no network limitations. You don't have to be worried about whether or not a company is a network. Now, Advantage plans, those replace original Medicare. The benefits can vary from plan to plan. You can get some of those extras like vision, hearing, and dental. Some of the major differences really are cost. Of course, not everybody can afford the extra premium of a supplemental every month. Network, you are not limited to a network with traditional Medicare. You can see any doctor that takes traditional Medicare. And of course, those extra benefits of the vision, hearing, and dental. So our open enrollment, this happens October 15th through December 7th of every year. It has not changed yet, and hopefully that stays. Now these are for Advantage and Part D prescription drug plans. So the supplemental plans are actually not subject to the open enrollment every year. You can pick up or change a supplemental at any point. You're just subject to that medical underwriting if you do. Now if you have extra help or full Medicaid, you can switch throughout the year. You can change it once a month, except during open enrollment. That won't let you use that extra help opportunity during open enrollment. So back to our Part D plans. We got those 12 plans ranging from $0 to $119.70 per month with a maximum deductible of $615. And then there's the coverage phases. You just have the deductible, the initial coverage, and what they call catastrophic coverage. They had to give it a scary word. But it really just means that you and your insurance company have paid out $2,100 for meds, and then they will cover the rest of your meds for the year. What I love about this is this past year, that was $2,000. So they only raised the out-of-pocket max by $100 this year, and in 2024, it was $8,000. So I still think we're doing good with the out-of-pocket max. I was happy with that. Now I kept this in here, so this has been this year. It started with this, but I just wanted to review it, that there is no donut holes. They're not bringing it back, but just in case you guys didn't know, they got rid of the donut hole. So basically, once you and your insurance company have paid out combined $2,100, all of the medications that are covered on your plan will be paid for at zero cost to you. I have some clients who reach that in January. And then for the rest of the year, their medications are covered at no cost to them. But that has caused several companies to no longer cover certain higher cost medications, so it's always super important to check your medications every year and make sure that they are still covered. So a little bit of a look at that and kind of how that works. You would pay, to start, you pay that $615 of your deductible if you have it. Not every plan has a deductible. Then you pay the co-pays. And you do that until a combined amount of $2,100 has been paid out. That is, again, between both you and the insurance company, not just what you're paying out of pocket. Once you and your plan have paid that $2,100, you have reached your out-of-pocket max for the year, and all medications your plan's covered will be paid for at zero cost to you for the remainder of the year. But any medications not covered by your plan will not be covered in any phase. Now, there is a secondary option for those of you who have maybe higher cost medications. So last year, the other thing that happened is Medicare started what's called the prescription payment plan. And the way this works is you cannot be charged more than $2,100 throughout the year. But not everybody can afford to walk into a pharmacy and pay $2,100 in a single month for their medications. So what you can do is you can contact either your Part D or your Advantage plan, and it's best to do this earlier in the year if you can. and ask to get put on a prescription payment plan. What they do is they will take that $2,100 and they will spread it out throughout the year, which is why it's better to do it earlier, because then you have an easier payment. Instead of paying at the pharmacy, you would pay your plan once a month, whatever amount they set, and then you don't pay anything to pick up your prescriptions. And that can spread out the cost of the medications for those who can't afford the higher cost at the pharmacy. You do have to call your insurance provider to set that up, though. Okay, so how is that monthly cost calculated? So your monthly bill is based on what you would have paid for any prescriptions you get, plus your previous month's balance, divided by the number of months left in the year. I'm gonna be honest, even as shift counselors, we don't quite know what they're doing with this. What we like to advise people with this is if you decide that you are interested in the payment plan, you call your insurance company, and I would check with them every month to make sure that you know what the payment is. It's not the most understandable system. We don't quite know how it is that they're dealing with these payments. So we just advise that you call and speak to your insurance company directly. The important thing though is that they can't charge you more than a total of $2,100 in a year. So is that a good option for you? Those most likely to benefit from this are those who have the higher cost medications, or who are going to reach that out-of-pocket max quick and can't afford the upfront cost. This might not be the best choice for you if your yearly drug costs are low, if they're about the same each month, if you don't want to change how you pay for your drugs, if you don't want to deal with paying the insurance company, if you get or are eligible for extra help from Medicare, most people with extra help don't have to, or if you're getting help paying for your drugs from other organizations. Advantage plans, what I know most of you are probably sitting here for. So there are 16 plans this year offered from 3 different companies, and the premiums range from $0 to $103. I actually found quite a lot of plans that are a $0 premium. But there is really a lot to consider with Advantage plans, especially this year. We need to consider, does it cover your doctors and hospitals? Does it cover the services you use regularly? Does it cover your medications? And we really need to be looking at more than just the premium each month for these plans. So a little new to our area, but not new to Medicare, I have learned there are about 3 plans in the area with what's called a Part B premium reduction, or a give back. One of those plans is a WellCare plan, the other one is a Humana. And those can range from $50 to $71, and what it is it's money from your Part B premium that's either returned to your Social Security check or taken off of your Part B bill. That's super cool. I learned that this has actually been around since 2003. This is just the first time we've seen it in our area for some reason. But I do want to point out and make note that this is, again, not a dynamic to choose an Advantage plan with. It's cool if you get it, but please don't make a decision just because you might save an extra $50 a month. We want to make sure people are in network and medications are covered above all else. So getting ready and some tips. Of course, read your annual notice of change from your current plan. Most people in here, that notice of change is bye, we're leaving. Renew notices from Social Security and Medicare sent out in the fall regarding eligibility for different programs. And of course, check your plan, which, I mean, most of you, it's just fun. So, how to review and switch plans. Online at Medicare.gov, you can do it yourself. You are welcome to. It's easier than you think. You can call 1-800-Medicare. You can be in person with a SHIP counselor, and I actually have a couple of other SHIP people here today that I will point out later. Or in person with a bold, underlined, italicized, and highlighted trusted broker. Okay? Make sure that if you're meeting with a broker that it's somebody that you know, trust, word of mouth, something. Very, very important. All right. So what you need for open enrollment. When you are reviewing your options in your plans, you need obviously your Medicare card. We can't sign you up for a plan if you don't know your Medicare number. Your list of doctors. I don't know why I put phone numbers on there. Really just need the names and where they're at. And of course your list of medications, either having those just available with you, or like a MyCarl account, a MyChart account to access your medications. Of course, and then if you need help, all organizations present, which would be myself, Champaign County Healthcare Consumers, I have Family Service here, and OSF. We are all ship counselors and can talk about appointments at the end of the meeting. And these are the local ship sites, so Champaign County Healthcare Consumers, Family Services. Evan, can you stand up and say hi, please? This is Evan with Family Services. And then we do have OSF here, Camille. OSF as well. So Chris Healthy Aging has been a ship site, but we are not positive that they are taking appointments. They might be worth reaching out to if you can't get one anywhere else and try. We're just not sure that they're actually taking appointments this year, but I put them up there just in case.
They are not. I checked.
You checked. They are not. Okay.
They are in Danville, but they're full. What does SHIP stand for?
Senior Health Insurance Program.
Thank you.
No problem. I might change that next year, so. All right. So a couple of resources to talk about. For some of you that might qualify, there is the Medicare Savings Program. If you qualify for Medicaid, you would qualify for this. You can even qualify for this if you don't quite qualify for Medicaid. This can help with your Part B premium and your Medicare coinsurances, depending on the level that you qualify for. And it's administered through the Department of Human Services. So if you already qualify for Medicaid, you would just go to the same place and apply. There is extra help. This one's actually through Social Security, is a little easier to qualify for. It is income and asset-based program that actually helps with prescription drug costs. You can get $0 premium-free plans or a reduced premium plan, no deductibles, and no coverage gap. There's also the Carl Financial Assistance Program, which Champaign County Healthcare Consumers can help you apply for, and you could receive a discount of up to about 100%. I know plenty of people that get that. There is a discount program for OSF, and CCHCC can help with completing those applications. Okay, another little note while I have you guys here, because I am ashamed that I did not think to put this in a slide. One of the things that I wanted to mention as well for those of you who are going from one insurance company to another, that is important to note, is with your medications. If you have a high-cost medication that took a prior authorization to get approved with your current insurance companies, they will pay for it. You will have to transfer that and do a prior authorization for those medications for the new plans as well. You might even have medications that didn't require prior authorization now do. So one of the things that you want to know and make sure that you cover is making sure that you know which medications are going to need a doctor to submit a prior authorization to your new insurance company. That isn't talked about enough, and I wanted to make sure that that was noted. But past that, that's it for the bulk of the information. I know you all probably have a ton of questions, so I will take questions.